Hello, my name is Candace Gay, and I'm a registered nurse, and I've recently participated in a debate with my health policy class at the University of North Carolina at Wilmington. And the debate that my classmates and I chose to have was based on North Carolina House Bill 196, which is in support of parental consent for sex education in public schools. And I feel that my discussion group chose this bill because it's easily debatable and quite controversial. North Carolina House Bill 196, Parental Consent for Sex Education, proposes that adolescents need their parents' consent before they participate in sex ed classes in public school. I strongly believe that parental consent should not be necessary for adolescents to participate in sex ed. This information is beneficial and prepares young people to make healthy, competent, and confident decisions about sex. Our discussion group did identify multiple reasons why this bill should not be passed. I feel like the best reason that we identified is that there are proven health benefits for those who have participated in sex ed programs. Studies have shown that when adolescents have participated in comprehensive sex ed programs, they delayed sexual initiation, they increased use of birth control and condoms, and had a lower rate of sexually transmitted diseases and incidental pregnancies. I feel that by granting young people the right to receive this comprehensive sex ed, we are equipping them and empowering them to make healthy decisions. This bill is important to nurses in North Carolina because as the medical professionals in North Carolina public schools, it's the nurses who primarily deliver this sex ed information to students. North Carolina employs baccalaureate prepared registered nurses in the school systems and relies on nurses to pay attention to current research, collect required data, and to get the continuing education that they need to present the most up-to-date education to our students. As nurses, we know that when we educate our patients about particular health topics, they have better outcomes. And as I previously stated, there have been a number of studies that show the benefits of sex education. There are those that argue that before young people participate in sex ed, that there should be parental consent. Why might they feel that way? I think that family values sometimes come into effect, as well as religious beliefs. I don't feel like those are valid reasons for a student to be denied information. Health information, important health information. Despite many religious teachings against premarital sex and the use of birth control, studies show that most students do have sex while they are in high school. Parents may not want their children to have sex, but studies show that 60% or more do have sex in high school. I feel that this bill should be stopped and go back to the drawing board. I think that parents should be informed that their children are going to be participating in sex ed, but they shouldn't be asked to consent. I think that that is an adolescent's right to receive that information. This bill was introduced in February of 2019, and has been through an amendment process and currently has been passed on to the North Carolina Commission on Education K through 12 committee. Hopefully it will be stopped, back to the drawing board, and adolescents will be given the right to receive sex ed without their parents' consent. Thank you.